Carole Treston. I'm not from Housing Works. She's from Housing Works, too. That's why I'm like, AIDS Alliance for Children, Youth, and Families. We've heard a lot today about, for women, the combination of poverty, family caretaking responsibilities, and issues such as partner violence, mental health, self-medication through substance abuse heightens the needs for case management and coordinated and accessible wraparound service in order to get and be retained into effective HIV care. For most women living with HIV, their experience is different. We heard today about how it's shaped by childhood abuse or domestic violence, weighed down by crushing poverty, yet still carrying family responsibilities that span generations. So how do we ensure that the hope of the National AIDS Strategy is obtainable for them? In my opinion, building on effective models and sustaining success while working towards the three primary goals of the National AIDS Strategy in a gender-sensitive, or in the case of youth-friendly way is key. Right now, the current unprecedented recompetition of the entire Part D portfolio has been defined in the Part D FOA as a response to the National AIDS Strategy. And you can't argue with this as a motivator. But it's also a microcosm of the challenge, sustaining current successes while maintaining patients in effective care, yet likely there will be significant reconfiguration of the distribution of resources to achieve these goals of the National AIDS Strategy. So really, the devil is in the details. And I just want to talk for a moment about some of those details. Currently, 91 grantees are funded by $78 million. In August, up to 200 grantees will be funded by $70 million. That's the same pot of money, only less. It's not $70 million additional dollars. So how will all of us, HRSA, ONAP, PACHA, David, and the community ensure that redirecting resources to areas where there is greatest unmet need, not only doesn't also create that same unmet need in currently funded areas in a few years? Who will be monitoring not only the impact of where the funding is going, but the impact on where it's going to be taken from? Getting more people, women and youth in our case, into medical care and reducing disparities, for example, increasing undetectable viral load, is a laudable goal, one that we are all behind. But how do we get there? We heard today about so many of the challenges in getting there and how deep the issues around getting women into care, adherent to care, are, and how long-standing they are. Yet despite that, strategic shifts such as a de-emphasis on case management and support services in the current Part D FOA compared to medical care doesn't seem to account for that, as we heard all day today. Women won't be in sustainable Medicare with undetectable viral load without Ryan White Care Act paid for case management and wraparound services, even with Medicaid expansion or other funded medical care. I have other comments about the impact on youth, but I'm going to table those for now. I know that youth's on the agenda tomorrow. Maybe somebody can read those comments in the youth section tomorrow. But in closing, I ask PACHA to be as concerned as AIDS Alliance and other members of the community are about the unintended consequences of the shifts and changes that will undoubtedly come over the next year and beyond as we attempt with limited or shrinking resources to meet the goals of the National AIDS Strategy. Not only through the Part D compete, that's probably just the first wave in strategic changes, but with other actions in the future years. Who will be monitoring, again, not only the impact of where the funding is going, but where it's been diminished or being taken from?